Hello viewers, welcome to another section of Parenting Fair with your host Sophia Esther. In today's video, I will be discussing with you what mental health disorder is in children and the 3 major ways to care for a mental health disorder children. Please, if today is your first time of coming to my channel, do not forget to subscribe and click the like button so as to get more content of my videos whenever I post them every Friday by 2 p.m. Thanks and enjoy the video. In today's video, I will be sharing with you what mental health disorder in children is and the 3 major ways to care for a child with mental health disorder. Now, let's quickly know what mental health disorder in children is. Now, mental health disorder in children is the disability that affects the child's mood, thinking, behavior, the way they feel, and act. Now, all over the world, there are many different types of mental disorder around the world, but generally, they are characterized under abnormal thoughts, perception, emotion, behavior, and relationship with others. Now, there are illnesses that are likely to be found around children with mental health disorder, and they are depression, anxiety disorder, eating disorder, and addictive disorder. Now, let's take them one after the other. Depression. Now, children with mental health disorder, they tend to be depressed at all times. And anxiety disorder, they tend to be afraid of their environment, sometimes feeling tired, sometimes breathing faster, and sometimes you found them acting funny. And eating disorder, you, the parents or the guardian or the sibling, tends to feed them. Sometimes they don't feed, they are not able to feed themselves. Even the ones that are able to feed themselves, you found them messing the environment up. Now, the last one is addictive disorder. Now, sometimes they tend to be addictive to some particular things, sometimes food or sometimes persons. They would like to be eating one particular set of food. They wouldn't want you to change it. Sometimes you can equally change it, but they tend to be addictive to some particular things which are food. And in terms of persons, there are some group of people they want to be with. There are some persons they like to be with. You find them carving to be with that person. They like expressing themselves with that person. They like being pampered. Let me use that word. Now, children with mental health disorder, it influences their learning. Mental health disorder influences the domain of learning in a child with mental health disorder. And the domain of learning are cognitive domain, affective domain, and psychomotor domain. Now, what is this cognitive domain? Now, cognitive domain involves the development of child mental skill, which is the ability to recall. Now, children with mental health disorder, they find it difficult to recall sometimes what you teach them or sometimes what they found around them. 50% of them find it difficult to recall things they have seen, or sometimes you the teacher or the parents taught them. Now, let's know what is affective domain. Now, affective domain talks about reactions, feelings, emotions, and attitude of a child around his environment. Now, they tend to react to some certain things. Sometimes you find these children acting funny, like I said, in the anxiety part of it. Sometimes there are some week you find those children not being okay. And there are some days you see them rejoicing, and there are some days you see them not being themselves. So they react to some certain things. There are some way they feel about some particular thing. Now, psychomotor domain involves physical movement of a child and the ability to exercise speed in learning and other physical activities in his or her environment. Now, these children, they are low learners. They find it difficult to learn fast. They don't exercise the ability of learning fast. Now, you, the parents or the teacher or the guardian teaching them a particular thing, has to put in more effort in teaching them a particular thing so they can understand and maybe recall fast. Now, let's look at the 3 ways of caring for a mental health this other child. Now, one of them is cordial relationship. Now, you, the caregiver or the parent or the guardian, tends to respect that child's feeling. Yes, you must respect that child's feelings, and you are equally expected to answer their questions, because sometimes the children with mental health disorder, they tend to ask funny questions, and they ask the question, you are expected to give them answers. Please do not withhold their answers. Give them the answers they want to hear at that particular time, because it makes them feel relaxed, and they will always want to ask you questions, and sometimes you don't know when they will ask you some important questions. So you, the parents, tends to, or the caregiver or the guardian, tends to establish a cordial relationship between that child with mental health disorder. Now, flow of communications. Yes, it is another means of caring for a child with mental health disorder. You, the parents, guardian, or siblings, or you, the one around that child, tends to establish a positive communication with that child, which means giving that child a listening ear. Please don't always shout at this child or try to beat the child because she does one funny thing or the other. Please establish a positive communication, because these children, they are always afraid of their environment. Sometimes you see them acting funny. Please, not because they act funny or because they have that mental health disorder in them, then you want to pull them aside. No, please, you, the parents, the guardian, or the person around this child, please establish a positive communication skill around this child. Now, the last one is spending quality time with this child. Yes, some of our parents or our siblings or our guardians who sees children with mental health disorder tends to pull them aside, which is not proper. Please try to spend quality time with those children. They need it. It makes them feel belonged. It makes them feel comfortable staying around their environment. Please do not disassociate yourself from them. Spend time with them. Take them to places you feel they like, places they enjoy being. Please take them there. And please allow them to associate with people they sincerely find comfort staying with, because sometimes they tend to express their fears, what they feel about the environment, to that particular person without telling you, the parents or the siblings. But because they find comfort staying with that particular person, they tend to express themselves to that person. And the last one is, please, our parents, this advice is for you. Try to send those children to special schools. Do not take them to that regular schools your other children goes to, or you see your neighbor children going to. Please take them to special school. They tend to be comfortable there, and there are methods of teachings they carry out there. So parents, please take those children with mental health disorder to special schools where they can equally teach them things they are going to learn and the ways they are going to learn it faster. All right, thank you for listening to my videos, and thank you for listening to this particular video. Please do not forget to subscribe. Thank you. All right, welcome back. I hope you enjoyed the video and you equally learned one or two things in it. Please remember to subscribe and click the like button so as to get more content of my videos whenever I post them every Friday by 2 p.m. See you next Friday.